After ACL surgery, one of the biggest challenges is getting your quad to fire the way that it should. That's where neuromuscular electric stimulation, or NMES, comes into play. Here's how to set it up. Ideally, bigger pads such as the 3-inch by 5-inch pads shown here are best, but the common 2x2 square pads will work. You'll place one pad on the lower inside part of your quad and the other pad high up and in the center of your thigh. The next step is to plug the leads to the electrodes and turn the unit on. Most units come with pre-adjusted settings, and others you can adjust some of the variables. Here are the research-based recommended parameters that can be used for muscle strengthening, but always defer to your physical therapist on exactly how to program your unit. To get the full benefit, the intensity needs to be turned up high enough to create a strong, visible muscle contraction. Ideally, it should be as strong as you can tolerate and enough that the quad is fully tightening. You may have to gradually acclimate yourself to higher intensities over time. Turn the intensity up slowly so your body has time to adjust. Here I'm using a unit with a trigger. However, most units will not have this feature. Regardless, if appropriate, you can combine the electric stim with exercises like quad sets, straight leg raises, terminal knee extensions, squats, or seated knee extensions. NMES will help wake that quad back up and improve strength gains in the early stages of recovery.